Are you willing to take the test? The shot, not the test, but the shot. So give us a call at 215-634-8065, toll free 1-866-361-0900. And we're waiting on our wonderful guest from GPHA, George Timbers. If you're listening, George, give us a call, 215-634-8065. Last week, we had the wonderful folks from the Strawberry Mansion CDC, Tanetta Graham and Tyrone Williams. So we talked a little bit about what's happening with gentrification, all the historical content of Strawberry Mansion, preserving the historical content of Strawberry Mansion. That's why we do what we do, really. And we all know what's going on around the city of Philadelphia with gentrification and all this stuff that's happening. I don't know how many of you folks were watching or listening to City Council yesterday regarding Philly COVID-19. It's a whole lot going on with folks, 22-year-old guy getting the contract, the keys to go inside the convention center. So I want to hear your thoughts about that. And I really want to hear, are you ready to take the test? There are so many people are putting together this whole thing about the vaccine, Pfizer, two or three other, even Johnson & Johnson is now in on the thing with the vaccines. So listen, you guys, we love you so much. We want to thank all our wonderful sponsors who've been supporting Recovery Talk 101. But now I want to tell you this, Recovery Idol, Virtual Recovery Idol is back. And here is the form. We want to make sure that you get this form. You can email me at d.forward@parronline.org to get the entry form. Again, we want to thank all our sponsors. Last year, we had the Virtual Recovery Idol, and it really went well. So again, we're looking to honor this year's champion for the Virtual Recovery Idol competition. Again, it's free and open to the public. Showcase your talent. Give us a call and get the entry form. So guess what? He's not answering. So I guess we're just going to keep things going. Again, tonight's show was sponsored by GPHA, Greater Philadelphia Health Action. And, so listen, we're going to take a break and we're going to come right back and get right back into the conversation. Thanks again.
Greater Philadelphia Health Action, GPHA, has been a champion of quality and comprehensive healthcare services for more than 50 years. GPHA is your total healthcare home, providing medical, dental, behavioral health, pharmacy, and child development services. GPHA now offers telehealth visits to connect you with a provider from the safety of your home. Sick visits, follow-ups, chronic disease medication management, subspecialty care, behavioral health therapy, dental, and more. Pediatrics through adults. Know your health. Know yourself. Be aware of your health and any underlying health issues that you may have. In-person appointments are also available, ensuring all CDC guidelines are followed for your safety. Schedule an appointment today with GPHA, 1-888-296-GPHA or gphainc.org. GPHA, your total healthcare home, 1-888-296-GPHA, or visit us online at gphainc.org. Save Cleaners, located at 900 West Girard Avenue, open Monday, Wednesday, and Friday from 7 a.m. to 5 p.m. 215-235-2040. Here's what some of their customers are saying about Save Cleaners. Joe says, most reasonably priced dry cleaners I've found. John says, great place, fair prices. And Marietta says, best place to take your clothes for the price, and they do a good job. That's Save Cleaners, located 900 West Girard Avenue, Monday, Wednesday, and Friday from 7 a.m. to 5 p.m. 215-235-2040. Men and Women for Human Excellence is a drug and alcohol treatment program seeking to strengthen, empower, and inspire individuals through holistic, person-first, strength-based recovery, such as drug and alcohol treatment to individuals and families through 2 levels of care, intensive outpatient and outpatient. They also provide assistance to individuals to begin the recovery process for issues related to their mental health status. Case management services are also provided to assist individuals in recovery with essential services that are necessary for a successful transition and integration into their communities as a productive, responsible citizen. One other service they provide is a substance-free living environment which alcohol and substance users can holistically rebuild their lives by using the person-first, strength-based approach that emphasizes recovery and resilience. They also provide free transportation. For more information, call 215-769-7045. That's 215-769-7045. They are a family-strengthening organization.
Hey neighbor, how you doing?
Oh, there's so much going on. It's hard to keep up.
Well, we got to get you caught up. Try contacting the Strawberry Mansion Community Development Corporation and the Strawberry Mansion Neighborhood Action Center, located at 2829 West Diamond Street. They can help you with utility bills, water bills, foreclosures, delinquent real estate taxes, weatherization, homeowner workshop, food giveaways, neighborhood news, and so much more. It's a one-stop shop. Just send your email to strawberrymansioncdc.org or strawberrymansionnac.org. You can also call them at 215-235-7505. Due to COVID, it's by appointment only, but call them and someone will definitely get you caught up.
Thanks, neighbor. I got to get up on this.
Hi, this is Council President Darrell Clark, and I listen to my main man, Rick Ford, heard here on 900 AM WURD.
Do you or a loved one suffer
From the town to the nation, we'd like to do a song for you about the larger picture. There's only one season lately. There used to be an agreement between the seasons that they would all come and stay for 3 months and then go to wherever seasons go when they're not where we are. Lately there has been no spring, no summer, and no fall. Politically and philosophically and psychologically, there has only been the season of ice. It is a season of frozen dreams and frozen nightmares, a scene of frozen progress and frozen ideas, frozen aspirations and inspirations. They call the season winter. We call the song Winter in America. Welcome the pilgrims into the buffalo that once ruled the plain. Like the vultures circling beneath the dark clouds, looking for the rain. Yes, been looking for the rain. Just like the city that stagger on the coastline, living in a nation that just can't take much more. Like the forest they buried beneath the highway, I never had a chance to grow. We never had a chance to grow. And now it's the winter. Seems like a winter in America. It's a time when all of the healers done been killed or been betrayed. Say, people know it's something wrong with everybody ought to know winter. Winter in America. soul. Lord knows it's a winter in America.
Hey, we back here at 900 AM WURD. And by the way, my Black History moment, Gil Scott Heron. On the line, we got our good friend George Timbers, who was employed over there at Greater Philadelphia Health Action. George, welcome to the show.
Thank you so much, Derek. I'm happy to be here.
I'm glad I'm happy you're here as well. So, I thought it was interesting, it's February, it's Black History Month, and I thought about historically music like Gil Scott Heron, who went to Lincoln University, and Roland Lamb. That's for you, Roland Lamb. All right. George, how's it going, man?
I'm doing well, thank you. The COVID has been a little rough, but for me, it's been pretty good, actually, because I had a chance to tell myself that at some point I'm going to have to retire. And since COVID won't let me go into the office every day,
yeah,
I'm starting to get used to being able to do the telehealth, which is a good way to communicate with my patients.
Yeah.
So it's okay. I'm all right. And then, you're in a position to help people get through this traumatic time. We have a lot more of anxiety, a lot more depression.
Yeah.
Or isolated, staying at home. And so at this point, I guess you know already, Rick, that anxiety is up.
Yeah.
Depression is up.
Yeah.
Suicide is up. And that's a biggie. Domestic disputes.
Yeah.
And violence. And of course, substance abuse. So I guess during the course of our conversation, we can cover most of those things.
Well, you know what, I want to start at the top of the list. Ironically, I was talking with Roland Lamb yesterday, and we were talking about running down the list of things that are happening in terms of 5,000 people who have died to overdose. Right. Listen to this, 5,000 people. Suicide rate, I think we're at 23% of suicide rates. It's a lot going on. So something you mentioned earlier, George, that working from home and doing telehealth, and I'll say this for the recovering community, this is one of my pet peeves. I always say that isolation leads to dark rooms where negatives are developed. So we're at a critical time right now, and I want people to really pay attention. Now that there's a host of different variations of the vaccines are out there, please don't sleep. I still want people to wear masks, wash your hands, and practice social distancing, right? And George,
Exactly.
So let's get right into some of the things that you guys are doing over there at GPHA, and I just want to kind of mention some of the locations. And maybe I'll let you mention all the locations that you guys are having over there for Greater Philadelphia Health Action. I know about South Philly, Alice.
Okay. I'll give them to you.
Okay, all right.
So we have 11 actually now.
All right.
11 sites. And those sites, I'll just run them off to you. We have the 1401 South 4th Street.
Yeah.
We do primarily, we have the individual counseling there, the therapy there, and we also have a medical department there, and we have a pharmacy there. That's the 1401 South 4th Street.
Alice, correct?
Alice, that's Alice.
Yeah. Okay.
Charles Patterson is the director over there. We have Chinatown Medical Services, Frankfurt Avenue Health. Well, the Chinatown is at it used to be at 930 Washington Avenue, but now it's at 6th and Spring Garden.
Which is critical for the Chinese community.
It's an excellent way for us to reach out to, and one thing about DPHA, it is extremely diverse.
Yeah. So
that everybody is pretty much included in the services that we deliver. And Chinatown is one of our primary healthcare centers. We have a couple of folks over there that Sophia and Snow that I work very closely with who do the behavioral healthcare services over there. And then we have the Frankfurt Avenue Healthcare Center. I'm located at Frankfurt Avenue right now. I'm not there right this minute, but that's where I usually work when I'm in the office. And that's at 4500 Frankfurt Avenue. And as you know, that was the hub of the opioid crisis almost across the country. It was one of the major areas, Kensington area over there, where people were using a lot of heroin, a lot of overdoses. So that's why we came up with our program, our MAP program, but I can talk to you a little bit about that after I go through these locations.
Yes.
We have dental and behavioral services at 5501 Woodland Avenue. So we have the behavioral health care there along with the dental program. We have a medical suite at Temple that we work with, and we also have a BHC working over there. Behavioral health consultant, that is a person that works with the dentist and also works with the primary care physicians whenever there's an anxiety disorder or any type of mental health issue. The behavioral health consultants work with that. In South Philadelphia, also we have, on Hunting Park Avenue in North Philadelphia, we have 1999 West Hunting Park Avenue. We have Snyder Avenue Dental Center, 640 Snyder Avenue.
Wow.
We have the Southeast Health Center, which is still in the Chinatown area. That's at 800 Washington Avenue. And what used to be called Wilson Park, a while back now, a couple years, is now called Moore, which is at 1401 South 31st Street.
Is that your headquarters?
That's the headquarters. That's where you have the administrative offices, and you also have a healthcare center and a behavioral health component in that building.
Right.
So that it's unique, it's beautiful, it's in the heart of an area that is troubled. And it works very well to have a beautiful building like that with the type of professional work services that we provide. It's really a wonderful thing. The last one I have is the 5000 Woodland Avenue Health Center. Did I mention 5501? I think I did tell you about that one. That's a health. That's where we do behavioral health at the 5501 and the dental, and then we have the Woodland Avenue Health Center, and we have a daycare at the Woodland Avenue Health Center, which is at 5000 Woodland Avenue.
Well, you know what's really interesting for those that are viewing and listening? I remember clearly that 30th Street location, your former CEO Ron had. Go over there to your 30th Street location because you guys have a plethora of services right in there. And I want to be clear, and I want you to kind of chime in on this, George, about services right there on the premise. Like he took me on the tour here, the dental lab, the pharmacy, all the services are right there in the community where folks don't have to travel because of fear factor and COVID-19. Those services are abundantly right there.
That's one of our main themes, Derek, is that we are a medical home. And we like to use that expression because it is a medical home and you can get everything done in one place. You can come in and get your dental, you can get your podiatry, you can get your behavioral health. And so and you can get your prescriptions filled. So you can get almost everything done right there in that one facility. And that's been the theme. When you said, Mr. Hegler, that was one of the things that he saw to be when he brought all this together. So he was kind of ahead of the programs in Philadelphia. And everybody is still trying to catch up with us. I had this little piece I wanted to tell you about GPHA. GPHA is like a fast-moving train. I mean, like a real swift train, like one of them Japanese trains. And when you work for GPHA, you got to get up in the morning, put your sneaks on, and get to running. I know you always did the recovery walk and the recovery. Well, you're not walking when you go to GPHA. You have to run because you have to keep up. And we're actually ahead of the game. Which in order for us to stay ahead of the game, all of us have to be sharp and stay well trained and get good professionals to come in and provide the services. Those people that come to us expect to get the top shelf quality services, and GPHA is there to provide those services for them.
Wow. It's great. And as you were talking, George, and mentioning the locations, you went around the city. You did South Philly, the upper part of South Philly, the lower part of South Philly. You did Chinatown. You did North Philly and Huntington Park. You did Woodland Avenue. You guys are all around servicing folks. So, you know, I had a great opportunity to have Bryant on the show. I had Dr. Young on the show. So you listen, this is what we do. And I think it's critical now. I want to talk a little bit more about, if you would like to, in terms of what's happening with the vaccines, and are you guys providing any type of services, how people can get, I use this word all the time, free, how they can get free and take advantage of the opportunities.
Well, my understand the staff, staff is able to get the vaccine now. Yeah. And the patients, all they have to do is tell their primary care physician that they want to get the vaccine. They put on the schedule, and then they're scheduled to come in and get their vaccines. That's great.
That's great. Yeah. And we want folks to, you know, I think Dr. Young, she was very artistic in terms of putting out vital information about the Tuskegee experiment, the different variations of all this stuff. And we're going to get Dr. Young back on again, because folks were asking a host of questions about services. So please give her my regards. I hope you're listening, Dr. Young. We're looking for you to come right back on 900 AM WURD. Yeah.
Well, Derek, can I chime in on that?
Sure.
I work very closely with Dr. Young. So I get a lesson in medicine and what medicine is all about, and about symptoms and about medical things. Every week, Dr. Young teaches me something new about any patient that we have. Wow. I mean, she goes in depth. And as a behavioral health consultant, which is one of the aspects of what we do, I am supposed to come in and give her some consultation about what's going on with this person, whether they have anxiety, depression, bipolar, schizophrenia, etc. And usually she ends up telling me more than I even can figure out about the person, because she's been working with them usually for a while. And we're working with a lot of people who are dealing with pain. Yeah. And of course, pain leads to taking benzodiazepines and things of that nature, and painkillers. And Dr. Young is a person who is like very, very careful not to get a person in a position whereby they're going to get addicted to anything. So I work very, very closely with her. And I wanted to say that first you have Brian, Mr. C on, then you have Dr. Young, and I had to follow these two persons. I'm saying, come on, you know, I mean, is this fair? But no, so I work with her very, very closely, and she is a very, very intelligent, a very caring person. Yeah. And that's one of the things that a medical home allows you to do. Derek, we talk a lot about integrated services, which, again, our organization is very far ahead when it comes to integrated services. It's been this way for a while. But also, the organization itself is integrated to the extent that it is extremely diverse, but we know each other. And we know each other well enough to be able to call on one another to help the whole body function as one. So persons from the top, persons that are like right at the front, and I commend all of those persons that are that have to go to work every day, that can't work at home and so forth. But everybody works very, very closely together, and I think that's one of the assets of Greater Philadelphia Health Action.
Yeah, I would agree. Kudos go out to some of your colleagues over there, my good friend Maggie Lyons and my good friend Marquisha. Where would I be if I didn't have Marquisha?
I tell you, Marquisha is very, very good, and she helped us get this Skype together so we could see each other.
Yes.
And Miss Lyons is she's a phenomenal leader when it comes to this behavioral health piece. There are so many components that people can't see that go into being able to provide quality services from the behavioral health perspective. There's a lot of scrutiny, there's a lot of monitoring, there's a lot of auditing. And given that, Ms. Lyons covers it all. Some of those places some of those sites I talk about, she manages all of those sites just about. And we have persons in just about all those sites, especially the behavioral healthcare consultants.
Yeah.
So she's a good leader, and when I talked about that train moving fast,
Yeah.
Maggie Lyons is driving that train when it comes to the behavioral health, and if you can't run fast enough, you're gonna get left behind. I'm telling you. So, but we learn a lot and we do a lot, and the main theme is to make sure we meet people where they are. We had a saying that GPHA is a place where people listen, where listening begins and learning and healing continues.
Yeah. You know what, George, what we're going to do is we're going to take a break. When we come back, and we want to open up the phone lines for those that are listening and viewing at 215-634-8065 or toll free 1-866-361-0900. George, when we come back, I want you to kind of dive into what's happening over at the Frankfurt location, being in the middle of the epidemic over there in Kensington and Frankfurt. And I want to talk to you a little bit about what do you see happening over there in that area over there. You're doing MAT over there, correct?
Correct. Mm-hmm.
So we're going to take a break, and we're going to come back and continue with George Timbers from Greater Philadelphia Health Action. We'll be right back.
Action GPHA has been a champion of quality and comprehensive healthcare services for more than 50 years. GPHA is your total healthcare home, providing medical, dental, behavioral health, pharmacy, and child development services. GPHA now offers telehealth visits to connect you with a provider from the safety of your home. Sick visits, follow-ups, chronic disease medication management, subspecialty care, behavioral health therapy, dental, and more. Pediatrics through adults. Know your health. Know yourself. Be aware of your health and any underlying health issues that you may have. In-person appointments are also available, ensuring all CDC guidelines are followed for your safety. Schedule an appointment today with GPHA, 1-888-296-GPHA or gphainc.org. GPHA, your total healthcare home, 1-888-296-GPHA or visit us online at gphainc.org. Do you or a loved one suffer from an addiction, trauma, or mental illness? Here at the Kirkbride Center, our mission is to help our patients, their families, and friends by providing a therapeutic environment for treatment and recovery. Located at 111 North 49th Street in West Philadelphia, Kirkbride provides both short and long-term inpatient care for adults who need help from recovering from mental illness and drug and alcohol addictions. And we specialize in the use of methadone and Suboxone for the treatment of opiate dependencies. This year, our staff has also pioneered a new long-term residential program for women with addictions who are survivors of trauma, the first of its kind in Philadelphia. Treatment is covered by most insurance plans, and county funding is accepted for those without insurance. Self-pay arrangements are also available, and referrals and admissions to the Kirkbride Center are accepted 24 hours a day, 7 days a week. For more information or to schedule an intake at the Kirkbride Center, please call our number at 215-471-2488 right away. Again, that's 215-471-2488. The Kirkbride Center is a proud sponsor of 900 AM WURD. There's a new option in Philadelphia for the moment a person decides to stop using drugs or alcohol. It's called Access Point, operated by Northeast Treatment Centers, the most trusted nonprofit provider of addiction treatment services in Philadelphia. At Access Point, you can walk in right now or anytime, 7 days a week, 24 hours a day. We know that waiting to receive medication is a big reason people don't follow through with treatment. At Access Point, once you make the decision to stop using, we can stabilize you and administer medication immediately. You are able to stay with us for up to 23 hours so we can monitor and treat withdrawal symptoms. We can then work with you to develop a plan of care and help move you into the most appropriate next level of care to meet your needs. If this is your day to make that decision and you want immediate attention, contact Access Point at 844-533-8200. That's 844-533-8200. We are located at 5th and Spring Garden. We are here when you need us. Access Point.
Hi, this is Council President Darrell Clark, and I listen to my main man, Rick Ford, heard here on 900 AM WURD.
Hi, I'm the First Lady of Recovery, Sheila Ford, and you're listening to Recovery Talk 101 with Rick Ford on 900 AM WURD and 96.1 FM.
Hey, we're back here at 900 AM WURD, and I'm back here with George Timbers over there at GPHA. George, let's get right into the discussion about your location here at Frankfurt Avenue, and I want you to help the viewers and listeners talking about the level of services in terms of MAT and define to them what MAT is.
Okay, I want to give a shout out to my brother Roland Lamb. You mentioned him. We are on a board together for the Continental Society. So I just want to say hi to him if he's listening. The MAT program, he does a lot of work in substance abuse and drug and alcohol, as you know. So he's one of the soldiers that's been fighting for to help people out who have fallen to the illness of drug addiction. The MAT program, Medical Assistance Treatment, is a program that utilizes an antagonist that we call buprenorphine, and that it's actually most people would know it as Suboxone. So when on the street, you know, the term is subs. They talk about subs. I got subs and this and that.
Yeah.
And so we use that to reduce the risk of overdose. Number one, it's an antagonist, so it stops it decreases the urge or the cravings. It stops the cravings. It cuts off the receptors to the brain, and it lets it. And so it increases in treatment retention. It also helps people stay in treatment. It improves social functioning. Gets people to the point where they can go around and not be thinking about when they have to get another dosage on, and that's even with the methadone. They don't have to go every day. You get one pill a month, and it's very closely monitored. You have to come in and give your urine screening so that we can determine that there's not any other type things in it. The biggest problem we have, Derek, right now with the Suboxone is that folks have a lot of anxiety, especially right now because of the COVID.
Yeah.
And with that anxiety and that depression, they turn to benzodiazepines as a means of kind of relaxing.
Yeah.
So on the one hand, you stop the craving for the opioid. On the other hand, it's, well, how do you do that? Because they're contraindicated. So you can't come in and take the benzodiazepine and take the buprenorphine. So it's kind of like we have to kind of like work with them to kind of get them to understand how dangerous it is to take Valiums and Xanax and things of that nature when you're on the Suboxone. But other than that, the Suboxone seems to be working very well with the people that we've had so far. Thank goodness we have not had overdoses. One of the things that some of the medical doctors have prescribed and the nurse practitioners, we're looking at reduction of harm.
Yeah.
How can we reduce the probability that somebody will use and have an overdose? It also reduces the risk of infectious disease.
Yeah.
Passing the needles around. It reduces criminal activity. People can get back to work. They don't have to go someplace every day to get some medicine to stop them from using. I'm not talking down on methadone. I'm just saying the difference between the methadone and the Suboxone.
Yeah.
So the concept is that it builds skills and emphasizes practicing makes perfect.
So let me ask you a question in terms of you guys that you address there on Frankfurt Avenue. You're just doing MAT there?
No, well, we're doing MAT there, but we also have a component that does regular individual therapy, regular counseling.
Okay, that's great.
And that's when a person comes in, they get an intake, they do a biopsychosocial, and then they get assigned to a counselor, and then they see that counselor on a regular basis for psychotherapeutic services.
Yeah.
So people are coming in for that as well. So that's somewhat separate from the MAT program. I'm working specifically with the MAT program, and then over at the Southeast Center, we have them working with the MAT program. And the MAT program is one that you have to pay close attention to because you're prescribing this medicine for them that needs close monitoring.
Yeah.
But the difference between the MAT program and some other programs is it is incumbent upon us to have a therapeutic aspect to it. So you have to have therapy along with it. You don't just get the medicine and roll.
Oh, yeah.
You get the medicine and then you have to talk to somebody about what's going on in your life.
Yeah.
So it's not the same as a regular counseling session every week, but you do have to be checked on. You do have to come in and give your urines. We do have to follow you through this whole thing. And like in that area, Derek, it's kind of rough because folks are exposed so much in that particular area of the Frankfurt area, exposed so much to the drugs that you have to really work hard to get them not to yield. But the cravings are much, much less than they were some years ago in terms of the Suboxone. So I think it's a good way to go for people who are looking for a way to stop having cravings for opioids.
Well,
there's another area of that people might not understand is that it's not always a person who was out just trying to get high. It's a lot of times it's because the person has had an accident, they were injured, they started taking Percocets, they graduated to oxycodone or continued on the Percocets and then couldn't get off. Yeah. So the Suboxone is a way that we can help you get off those medicines.
Yeah. So
drugs, I'm sorry.
When I think about that location, I always ask this kind of question. What's the morale like with the staff over there? And, I'm quite sure you guys have all the precautionary things in place, PPE, everybody's wearing a mask, that whole thing. But how is the morale for your internal staff over there on Frankfurt Avenue?
Well, if we look at what was going on before the virus, folks were, like I said, it was medical home and it's a family type atmosphere. I think we kind of miss each other.
Yeah.
Because, there's a lot, you got to give each other a lot of support. You know as well as I do that whether you're a therapist, a nurse, a doctor, or whatever your position is, you need somebody that you can bounce things off. Yeah. Somebody that you can trust. I mean, some of us need professional therapists ourselves.
Yeah.
But when you have somebody that you can maybe walk over to their office or somebody that you can smile at in the morning and look for, that helps a lot. So I would say that the morale is pretty good considering the conditions.
Yeah. I'm glad you said that, George. And I think one of the things that I think you mentioned when we were in graduate school, they say the blessed clinicians or therapists need therapy themselves.
Absolutely.
And I'm about to actually go sign up and get me some more therapy because there's a lot that's going on with me in terms of the work I'm doing and some other external factors. You mentioned Frankfurt Avenue. We have an office over there on Torresdale Avenue, and I strategically ride through Kensington Avenue every day just to check the temperature and get a pulse on what's happening down there. And I share with people, that's not a movie. It's not a movie. Folks are out there using and dying and defecating, selling drugs and causing harm more than anything else, George. What I'm more afraid of is watching our young kids who have to go to school and walk through that stuff and see folks urinating and defecating, having sex. All these things that kids, what do we do to put some prevention, intervention programs in place so that they don't become a victim of this disease?
We're doing the best we can to get into the school system.
Yeah.
I think it needs to start at an early age, and children need to be deprogrammed from what they've been taught and get a whole new understanding and concept of how to take care of themselves.
Yeah.
Derek, I focus on something that may sound very simplistic and sophomoric, and I'm using that term because my pastor, Pastor Waller, and you know that for yourself that you go to this Enon Baptist Church. And Pastor Waller always says this may sound simplistic and sophomoric, but it has, to me, worked. And I'd just like to run through this really quickly if you just give me a couple of minutes.
Sure.
One of the things that I work with my MAP people, number one, is before the COVID was, we had group once a week. And it was amazing as to how many people actually came in for group.
Yeah.
Who, I mean, some would come in and, Derek, they'd be so high. And then the rest of the group would support them as best they could to help them get, and we've actually retained many of those folks, and a lot of them have actually, thank God, gotten off of the opioids and are doing well. So we have several success stories that I could tell you about at another time, but I want to tell you what I meant when I said this may sound sophomoric. One of the things I ask people, now you know about cognitive behavioral therapy, you know about Gestalt, you know about motivational interviewing and all of that. That's great because that's evidence-based, and that puts us into the area of science where they can kind of check to see if we know what we're doing. They can look back on and say, what did you do to get that person there? But one of the things that I do beyond that for my people that I work with is I talk about drinking water. I just start off with like, do you drink water? Do you know that so many people forget to drink water?
Wow.
So they end up with the liver problem, the kidney problem, and other problems that come from that because our bodies are, 90% water or something?
Yeah.
And God made water for a reason. The other thing, I have like a 6 or 7, I'm going to go real quick as I can. Eat nutritious meals, because we're all set up for the fast food you know what I mean? So you got the fast food all in these areas where you'll find a lot of drug addiction and you'll find a lot of need for that kind of thing because people aren't cooking at home, they aren't eating at home, and they aren't eating nutritious meals. I talk about sleep.
Yeah.
And folks don't get enough sleep. Now that's not something you can just say, well, I'm going to go get some sleep and I'll be better. A lot of times you need some help with that, and that's something that you should talk to your doctor about. Talk to your PCP, talk about, or to your nurse, talk to them about how you can get some sleep. But there's things that you can do to help get you sleep, like exercise.
Yeah.
That's another piece of what I talk about. I talk about music, listening to some music every now and then, shutting everything out. We call one of those ways, we call it mindfulness to a certain extent.
Yeah.
That's meditation. Get some music and meditate like you do. I mean, you've been with music for a while. You were with music with Billy Paul, with some of the young men who are doing music in North Philly. I know you about that. So music, social interactions, being around people. Now, we can't do it as much as we used to. So that's another area that causes people to get a little bit depressed.
Yeah.
And let me see. So, and the last one that I talk about, I don't focus on it too much, but spirituality.
Yeah.
I believe that if you have the pie and that one piece of the pie is not there, it's going to be difficult for you to be your whole self. I call it self-preservation. Well, we do that in our group, and believe it or not, it works as well as any type of evidence-based therapeutic approach intervention that we have, because people begin to think about these things about, are you going to go for a walk? Are you going to go to the gym? One of my guys, 60-some years old, just started going to the gym. He loves it.
Wow.
And he was really deeply involved in addiction. And I want to say, while I have a chance, stigma. Folks don't want to go in and tell somebody, I got a problem. Even if it's an addiction problem or if it's just an emotional problem. GPHA is in a position, because of our integrated services, when you come in the door and you come in for your annual physical, we want to know everything else.
Yeah.
So the doctors say, well, okay, this is okay, your heart's good, your blood pressure's good, this and that. And the other. And they say to the doctor, yeah, all that's cool, but I don't feel so good. You know, and then they say, well, okay, I tell you what, I have a behavioral health consultant I'm going to refer you to.
Yeah.
And so they'll give me or one of the other behavioral health consultants a call. We have one stationed at each health center, and that's a part of what we are calling integrated services.
That's great. George, hold that, George. We got a caller, Charles, calling on line 1. Charles,
Okay.
welcome to the show, Charles.
Thank you, Rick, for having me on. And I wanted to call in and say hello to George Timbers, my coworker. Let him know that he's doing an excellent job. He sounds great, very intelligent. And I wanted to also answer your question in the beginning, Rick. I have taken the first shot of the Moderna vaccine.
Great.
Given out a GPHA. I'm due for my scheduled second shot on the 10th. And I encourage people, especially African-American community, to go out and take the vaccine. We need to stop the spread of this virus, and we can only do that by protecting ourselves and everyone around you. Continue to wear a mask and all those things, but definitely take the vaccine shot. And that's basically what I wanted to say, and just wish George much success. You're doing great, and thank you very much. One other thing, I want to ask people to say a prayer, a special prayer to a friend of mine's daughter who's having surgery on Monday, Brother Steve Cox. I'm not sure if you know him or not, Rick, but
Yeah.
his daughter is having a major surgery on Monday, and I want everyone to say a prayer, especially for her coming up this Monday. Thank you.
Wow, that's great. Charles, that's good, man. And Charles, you're located down there at Alice's.
Yeah, Charles is at 4th and Reed.
That's great, man.
Yeah,
So we're going to go down there and see Charles. You know, it's funny, talking about saying a prayer, one of my good friends, Kenny, Reverend White, not only is he been hospitalized, but we got some real bad news today. He has pneumonia and also COVID. So I'm praying for Kenny White, and you guys that know Kenny White and his family, you guys pray for Kenny White. He is a part of what we created up in Strawberry Mansion, and we talked about that today. So I think we got another call on the line, George. We got Yusef on line 2.
Okay.
Yusef. Are you there, Yusef?
Yes, good evening.
Who?
I wanted to thank you for being an upstanding human being, because your concern for what is going on Kensington Avenue and Lehigh in that area, Kensington and Somerset, is consistent. Seems like every week I hear you speaking on the stuff that's going on down there. And it's a shame because you got city officials, they could do something about that, okay? The city government has the right to stop that anytime they want to. But they won't do it. They want to leave it up to people like you, people like me, to keep speaking on it and keep bringing it up and keep insisting that, you know, these people are human beings who've been through something. We know what your guys have been through something. I know people personally that got hooked on drugs and have since passed, but I know what they've been through. And so I pray for the ones that are still out there on that stuff. But you're consistent, man, and that's what I appreciate. Now, last week you was talking about the Wanamaker's up in Strawberry Mansion.
Yeah.
I know that personally. They started off in Francisville. Then they went to Shawswood. Then they went to Strawberry Mansion. I know the whole family.
Yeah.
Yes, sir.
Thanks, Yusef, for calling, man. And I appreciate you. I appreciate you constantly listening and keeping up on what's going on. All right?
Can I say something to Yusef about, you know, how you're feeling and how I'm feeling about people who are addicted? You know, this wonderful show is coming out about Billie Holiday to tell the true story of who she was. And, you know, when I was coming up, Derek, you know, it was persons who were addicted were considered criminals.
Yeah.
And, you know, they would lock people up and plant drugs on them and do all kinds of things to people. And now we finally turned the corner where we understand that it's more of an illness than it is anything. I mean, criminal activity comes as a result of the need to fulfill like the cravings, and you have to go out and you have to buy the drugs. But that's after the fact. The fact is that it's an illness, and if we can be kind of like be more compassionate and develop a higher degree of empathy for people who are addicted, and not criticize them so much for their negative behavior, but try to work with them and give them a person-centered approach, like Carl Rogers type, Rogerian type approach to, like, how can I meet this person where they are? And help them get through this process using things like I talked earlier about motivational interviewing and things of that nature, so that people, like the brother said, we're human too, we're real too, and we've been through some things too, and we just need to continue to do that. I think GPHA is right there where they need to be, and we get a lot of people that come in and thank us for being human and understanding, who they are and what they're about.
So we're going to wrap things up. George, anybody you want to thank before we let you go?
Well, I want to talk about my granddaughter, Aaliyah Jasper. That's my granddaughter, and everybody talks about their grandkids, and this is my little baby. She's a little teeny one, and so I just want to say hi to her and to all of my family, of course, Kevin, Amir, Amez. I want to thank Ms. Lyons again for putting me out there, and I want to just say something really quickly about Matthew in the Bible. And I want to tell you why I do what I do. It's really just because when Jesus wanted to know, when he said, when I was hungry and you gave me something to eat, I was thirsty and you gave me something to drink, I was a stranger and you invited me in. I needed clothes and you clothed me. I was sick and you looked after me. I was in prison and you came to me. And then they said to him, well, when did all of this happen? And he says, that what you do to the least of those, that what you have done for me.
Yeah.
That's what drives me, Derek. That's what keeps me going, because the least of them need us. And if we can help in any way with God's help, I think that's what we're obligated to do. As Pastor Wall would say, that's our assignment.
Yeah. So, George, I just want to thank you, man. 1 hour goes so quick, doesn't it?
I tell you, it speeds by. I'm trying to get it all in. We'll come back and do it again. By the way, every first Saturday of the month, you can hear from GPHA right here at 900 AM WURD. My final words have always been, love someone because someone needs to love you back. We want to thank our wonderful staff over there at 900 AM WURD, our producer Mike for holding things down. And guess what? Don't change that dial. Stay tuned for our good friend Lloyd's Cummings. Until next week, peace, and we're out of here.